Hi guys, welcome to Attune Bodywork. My name is Cambria Marshall and this is Whitney Green, and we're here to show you a couple easy home techniques for muscle release with your tennis ball. Alright, let's get started. Hey guys, so now we're going to work some areas of the glutes and the piriformis specifically. This is really good for people with sciatica and people who sit all day. A lot of these areas in the glute near the tailbone get overcondensed and get really tight after a long day sitting at the computer. And if anybody who is suffering from sciatica knows that this is a big area that helps relieve some tension. So we're going to take our tennis ball and we're going to use it right in the center of the glute. So the way you find this spot is you find that bone on the base of your spine. And you're going to go right about halfway with it, and you're going to place your ball there. You're going to slowly roll back onto it. And again, I want you to be right in the tissue. I don't want you to be on the bone, and I don't want you to be feeling any huge referrals of down into the leg, because that would indicate that you're maybe on the sciatic nerve itself. This just kind of feels like it hurts a little bit. So I'm going to take my opposite leg and I'm going to bend it and place my foot on the ground to keep it stable. And I'm just going to allow my body, and I'm going to take my leg that I'm working and outwardly rotate it a little bit and let it just rest on the ground. This is going to be the most comfortable position that you can just lay there for a few minutes and let it melt in. Don't forget to breathe. After a few minutes, you can start your movement. So I'm going to think about how to open this. So I'm pinning the muscle at the glute. So maybe I'm going to take my knee out to the side. Yeah, that feels really good. It's also a little intense, so making sure you're breathing. If you cannot breathe, ease off a little bit. You can roll to your left a little bit. Or you can take the ball off, or you can use something softer. But exploring the range of motion with the knee, again, thinking about you're stretching the tissue. I really like to use this image of rolling out dough with a pin roller. It's not just lengthening the dough, it's expanding it in every direction. So that's kind of what we're doing essentially with the fascia and the tissue. We're helping it to expand. You can go all the way up. If you find a really good spot, don't just dig into it, just sit there and breathe. Think of like a yin yoga class where you just want to sit here for as long as possible, even though it's really uncomfortable and it might bring up stuff. The body will respond to it, will work with us, and will melt. After I feel it fade a little bit, I'm going to come back down. Another thing I can do is work with inward and outward rotation, medial or lateral rotation, if you will. Now when I go in, I can really feel it. I can even work with this leg coming in and finding a nice space, just chill out and let that sink. I can also think about my upper body. Even as I was doing that, I felt my upper body tensing. I want to relax this. I want to maybe work with my hips. I want to get creative. What's going to work for you today? Each day may be a little different because your body's going to be a little different. But just be an explorer. Don't be afraid to try something. It's all going to be okay. It's all pretty safe. Just make sure that you're using something with a little give, so you're not using a lacrosse ball, or if you are, don't be digging your body into it. And you're just being really mindful of what productive pain is versus holding your breath trying to fight at pain. You want your nervous system to be really relaxed during this process. You want this to be a cooperation between your mind and your body. So after I've explored all that region, you could, to specifically get the piriformis, bring this leg, if it's accessible to you, into a figure 4 onto the other leg, and lightly traction down and lightly roll around from this. This is going to make it more intense, so I definitely recommend doing a few minutes of the other way first, before you get into this area, but this is going to be very specific for sciatica. I can traction, I can even come up onto my toes. That's really going to get it. Great. After most of that is nice and open, I'm just going to come back down to my starting place, sit there for about 30 seconds, and then gently roll off the ball. All right, thanks.